Hi everyone, I'm Leanne,
And I'm Mike the Unforgettable.
and this is Unschooled History. And today we're talking about weird medicine. First, what do cosmetics and medicine have in common? It's our first weird medicine, antimony, also known as coal. Today, we're most familiar with this mineral as the eyeliners used by the ancient Egyptians and in Middle Eastern countries. However, our ancestors also noticed something else about antimony. It cleans out the system.
I've heard that.
And
I've used antimony once before,
you have.
not as a purgant for the system, but I actually put the eyeliner around my eyes like the Egyptians did.
Oh, that's cool.
The antimony was expensive. Getting powder just right was a pain in the rump.
Oh, try being an ancient Egyptian. They not only had to powder it just right, but they had to apply it with their own spit.
I didn't use spit, but I read that and I went for looking for substitutes.
Well, in Rome, it was made into cups, and they would pour wine into the cups. And the acidity of the wine would cause the antimony to leach into the wine, causing the consumer to both vomit and have the runs.
Yeah,
It
yeah,
is right. If it was in your system, it was coming out.
yeah, I can believe that.
And it comes out of the human system unchanged. Completely unchanged. Because of that, it was made into pills.
I've seen the pills before.
You've seen the pills?
Didn't have the courage to take them or do anything with them. But I've seen pictures of the pills.
Well, they're everlasting pills. People would buy one for the entire family. One pill. After it made it to the other end, they would clean it off and someone else would use it. These cups and pills would get passed down through generations.
I'm wondering how they avoided E. coli.
That is one part of the estate that I wouldn't want to inherit.
Yeah,
Never mind, of course, that antimony is toxic, with effects similar to arsenic poisoning. Now we have trepanation. Trepanation is the drilling of a hole in the skull. It started in the Stone Age. The skull on the right is Neolithic. It's the earliest known surgery.
holy skulls.
That was a bad pun. Holy skulls.
Well, considering what they were doing, I mean, I've heard and I've seen pictures of the ancient Egyptians having done it, but I didn't know when farther back than the Egyptians.
I'll talk about getting stoned, right?
Oh, and I thought I did bad humor.
And we did this for literally thousands of years.
Yeah,
Thousands of years. The image of the left is a 16th century painting depicting the process. It's not just the Europeans who did it either. There is evidence that this was done all over the world from ancient times and for multiple reasons. For everything from releasing evil spirits to treating seizures and fractured skulls.
well, I know it was done to treat injuries on the pyramids. People get injured and then remove it to relieve pressure on the brain.
Oh, well, that's kind of cool. So they understood what they were doing, so, sort of.
Yeah, it's amazing when you look at the ancient Egyptian medicine how much they knew.
Well, and that leads us to the cool part. The evidence is that infection rates were low and survival rates were high.
Mhm.
And it's still done today. I'm not even kidding. But today it's called a craniotomy if the segment of bone is replaced, and a craniectomy if it's not replaced. And also today it's done with a diamond bit drill.
Yeah, back then they used stones, chisels. Um, and if I may also add, it's slightly off topic, they used to use honey as an antibiotic.
Which we know about today. And of course, honey, following on that tangent, of course,
Yeah,
we discovered a tomb with honey that was still edible. An ancient Egyptian tomb with honey that was still edible, and it just had to be put in some warm water to reliquefy it.
Yes, and it was almost 5,000 years old.
All because of honey's naturally antibiotic properties, which is really, really awesome. Although we still don't know what was going on with the funnel on the guy's head or the reason that the woman has a book on her head and why she and a monk are consulting on the on the trepanation in this picture.
Unless this one is somehow to get rid of evil spirits in the body.
Possible. Could be there as part of a blessing, but we don't understand the funnel. Explain the funnel, Michael. You can't, can you?
Not unless you're going to use it later as part of the surgery. He's just using it there because he didn't have a table stored on.
But there's a table there in the picture.
Out of his reach.
Oh, well, true, it is out of his reach. For now. I just feel sorry for the guy because he's wide awake.
Well, from what I understand, the ancient Egyptians kept their patients wide awake, too. They were just giving them bone or something to possibly chew on, or a stick, or maybe a little beer.
Whatever. I'm just super glad that the patient is not kept fully awake anymore. Okay, so now let's talk mental health because things get weird in the mental health area too. If you thought it took forever for us to advance in physical health, you won't believe how long it took psychology and psychiatry to advance to its current point. After all, there are still people out there who believe that mental health issues are all caused by demons.
Not saying there aren't problems with demons, but that is ruled out in the rite of exorcism. The very first thing is rule out whether it's a mental health issue or it is actual demons. And they'll tell you, actual exorcists will tell you 99.9% of all problems are actually psychiatric problems rather than
Demonic.
But when it's demonic, it's evident because it's more than just psychiatric manifestations, there are physical manifestations.
Oh yeah, real exorcists, they will do the research, they will dive in, they will check it out. And I just think it's sad that there are still people out there who believe that everything mental health is actually demonic.
Yeah.
I mean, that has got to be detrimental to their families and especially to their children. I feel sorry for their kids.
Yeah.
I hope their kids grow up to be smarter than they are.
Yeah.
Okay, but this is something else we thought was a thing of the past. Electroconvulsive therapy.
Shocking.
But they still do it. I know, even more
unfortunately.
shocking, right?
Unfortunately, I knew that.
It wasn't done to you, was it?
No, but I've known somebody who had it done to them.
Oh, that sucks. But it's still used, and it's actually like 50% effective on people with severe bipolar or unipolar depression. And it's also used for some cases of catatonia, mania, and very rarely in schizophrenia patients. This one, thankfully, is no longer in use. This is the surprise bath. And this particular model is on display at the Glore Psychiatric Museum in St. Joseph, Missouri.
You've been there, haven't you?
Yes, I have. I have been there. They say it's haunted. And
That'd be something to take a look at.
well, I never saw anything, but they say that it's haunted. One of the stories that I heard was that there is apparently this guy who shows up and tells people to get out, which, come to think of it, isn't that actually a fairly common story about ghosts?
Yeah. They don't supposed to be like their area being intruded upon. Oh, the idea behind the bath.
Okay, so the idea behind this bath, this potentially dangerous treatment was that the patient was sedated by being dropped without warning into a tub of ice water. And that's what made it dangerous. Okay, we know about people like the Polar Bear Club who on January 1st will dive in the nude into a body of freezing cold water.
Either nude or limitedly dressed.
Yeah, or limitedly dressed, yes. Maybe just a Speedo.
Yeah.
But the thing is, they are prepared for that shock.
Yeah, they've psyched themselves up for it.
When you are dropped into water like that unexpectedly, your body is not ready for that shock. And that shock can actually kill you. And that is why people who are actually really, really good swimmers can end up drowning in ice water, not because of failure to swim, but because of the shock to their system.
Can't it throw them into a heart attack?
Yes, it can. And this wasn't the only water treatment. There were also showers and warm baths for sedation. And I don't know about you, I like a nice warm soak just as well as anybody. And it's great if you've got like sore muscles. Oh, it's wonderful. But these warm baths for sedation could last for days. And I saw the baths for that during my visit to the Glore as well.
Yeah.
And in order to keep the people from drowning, they had a cover over the entire bath with just enough room for you to stick your head out and help keep your head above water.
Oh boy.
Yeah, so it was interesting. It really was.
By the way, I want to say, some of these we may seem to be taking it a little lightly. We don't take this medicine lightly. It's just we've had a lot of experience talking and researching this, and sometimes we have to deal with it because some of the what nowadays would be classified as absurdity, but at the time this was logic.
Besides, I'm a nurse's daughter. I grew up listening to what they call like graveyard humor
Yeah.
or gallows humor. My mother has it a little bit, and it's really the best way to deal with something like this. If you end up having a lot of experience with the macabre or with any dark subject, you end up with a sense of gallows humor. And
or if you're former military.
yes, or if you're former military. Michael is former Air Force.
It's not that we're uncaring; it's that we develop harsh outer skin to it. To deal
Hell,
with it.
we're going to admit right now, I am bipolar with severe anxiety. And Michael, do you want to talk about?
I'm severely bipolar with anxiety disorder, among other things.
So we have our own experience with mental health, and that's partly why this appeals to us so much, and why we are able to understand so much of the terminology and what's going on. So, like Michael said, it's not that we don't care, it's just we use humor in order to keep ourselves from getting too depressed. And it's something that works really well for a lot of people. It's an excellent coping mechanism.
And it also drives our curiosity to learn more about this.
It really does. This display is also at the Glore Psychiatric Museum. It is called the Patient Treadmill. Like Michael said, I've been to the Glore. I know approximately how large this is. The patient treadmill can accommodate an average to slightly tall human being. But that door, you may have noticed, is really short. To give you an idea, I'm 5'6.5", 5'7", somewhere in there, depending on who's measuring me. On my passport, it says 5'7". I've had two doctors measure me at 5'6.5", one at 5'7" a quarter. So, whatever. But, so approximately 5'7". And that podium comes approximately to my waist. So, if that gives you an idea about how tall that door is and approximately how wide it is. So the patient had to kind of duck to get in there. And the whole idea was that a patient with excess energy would just walk it off. They would just walk it off inside this dark treadmill.
Basically, it's a human hamster wheel.
Basically, yeah. And it was dark inside. There's no light.
There's no light. There's no windows. There's no. I'm assuming since this was an older thing, you didn't have headphones in the thing. So there's no sound. It's all boarded up. There's no windows. So you're just in there in the quiet, in the dark, walking.
But perhaps the weirdest thing at the Galore is this little display. These are all things removed from one patient's stomach. One person swallowed all of this. This is actually a real medical condition. I can't remember the name of it now.
Neither can I.
But what it does is it causes you to crave non-food items. Common items to be craved are dirt, paper, clay. I've heard of people craving Play-Doh. This particular person swallowed over 200 nails, buttons, and other items. And it was all removed from the patient and made into this nice little display at the Galore.
Was it removed while he was alive or post-mortem?
Alive. The surgery was done while he was alive. Oh, actually, no, it was a she.
It was she. Okay.
Yeah, it was a woman who swallowed all of this. And that just shows that mental illness can make you do some really, really weird things if it's not correctly managed. And I am so glad that we have come as far as we have on mental illness, because it means that things like this are being better managed by doctors who actually know what they're doing.
Well, actually, while we're here, I want to mention something that reminded me. There's an illness where people will eat and eat and eat and eat, and they don't stop because they don't sense being full.
Yes.
It used to be prescribed as a psychiatric illness.
But now they know it's caused by a hormone. It's actually physical, not psychiatric.
It's both a hormone and something in the stomach is missing. A little, basically, for lack of a better expression, electronic sensor that senses when the stomach is full. It's nerves that says when the stomach is full. And so, okay, send the message, we're full down here.
And those nerves are actually controlled by the hormone leptin. So it is mostly the hormone at fault.
So it's a physical condition that used to be treated as a psychiatric.
It's also weird, but it is manageable today, and it can be treated just like the desire to eat weird things. Speaking of swallowing things, let's talk about the tapeworm diet. This stupid diet started in the late Victorian and early Edwardian era. The idea was that you would swallow a tapeworm egg and it would eat everything. It would eat the food that you ate so that you didn't have to change your diet and you didn't have to exercise, but you would still lose weight. And you can see there's a advertisement on here from the 50s for lard to be gone, now with live tapeworm eggs. This is scary and it is stupid.
I hate to tell you this. There was an instance in the 80s where this started to make a comeback, and certain TV shows made fun of it and pointed out how dangerous it was. It was short-lived, thankfully.
thankfully, but actually there's still people doing it.
Oi.
I'm not even kidding. There are still people doing it. And there was actually an episode of, I think it was an episode of House. And that would be early 2000s when there was this episode talking about it. And I think there was also maybe an episode of Scrubs. I cannot remember which episode
I don't
or
remember.
which TV show it was. I have watched a lot of medical dramas and comedies, haven't I?
We both have.
And that's not to say that I take all of my medical information from these shows. I don't. Okay, I get some from MASH. I get some outdated information from MASH because my mother has told me what's true and what's not. Like the episode where Father Mulcahy has to perform a tracheotomy. My mother says that that's still the basic procedure for how it's done, but it should still not be done by a professional. Do not
Be not
think,
done by amateur.
yes, should not be done by an amateur. Do not watch that episode of MASH and think all of a sudden that you can perform a tracheotomy just because you have watched that episode of MASH, because let me tell you, it is not something to be done by amateurs.
No.
I have taken anatomy and physiology, and I got squeamish dealing with that class. I don't think I could do it,
No.
especially with how tough the cartilage is in your neck.
What I like to do is watch some of these anatomy and science and doctor shows, and if there's something that piques my interest, I'll take what they say on it, make a note of it mentally, and then look it up after the show to find out if what they say jives with the truth or is off. And I look at professional medical sites, or if doubt, I will contact my own physician and ask her when she's got the time as a non-emergency question if it's true or not.
But back to the tapeworm, somebody actually decided to do the tapeworm diet as an experiment, an actual doctor. He actually decided to swallow the tapeworm egg and try the tapeworm diet as an experience to monitor how it actually worked. And what he found out is you're not actually likely to lose weight on the tapeworm diet. Instead, you just become really badly malnourished and you're actually more likely to gain weight. He actually gained 4 pounds while on the tapeworm diet. So it's weird, it's dangerous, it's stupid. Don't do it. Something really creepy. When George Washington died, one of his doctors wanted to bring him back to life with a blood transfusion.
Okay.
He was 100% certain it would work. 100% certainty is always scary in medicine.
Uh-huh.
He was 100% certain that if he warmed Washington's dead body up by degrees and filled his veins with sheep's blood, Washington would be brought back to life.
That just sounds like a bad idea.
Aren't you glad that we don't acknowledge this as real medicine today?
Yes.
So it was bizarre.
Yeah.
I also want to point out that this technique had already been banned in France because it had been used and the recipient had reported feeling like he was turning into a sheep. Guess he was kind of bashful after that about being outside.
Would it be a used body dealership?
Oy. Well, at least that patient wasn't dead when they decided to put in the sheep's blood. Washington was dead. Fortunately, Martha and the rest of the family stepped in and kept him from trying any such thing, insisting that the former president be remembered as he was, rather than as, well, a zombie. After all, who wants a president wandering around going, brains, brains?
Haven't we already had some presidents like that?
Let's not get so political.
I'm not going to say which party, but I think I think we've had some on both parties.
That's true. That is so very, very true. On to the next bit of creepy and morbid. This is post-mortem fetal extrusion, also known as coffin birth. What has happened is that the woman died while pregnant, and interestingly enough, the medieval woman whose skeleton is seen in this scene
Yeah.
had trepanation done. So this actually kind of ties back to...
So we got sort of a twofer here.
Yes, we have a twofer here. It ties back to the trepanation we talked about earlier.
Yeah.
According to the article in Smithsonian Magazine where I read about this, it was likely done for her as a treatment for preeclampsia.
Okay.
So what happens in coffin birth, as far as we know, is that the gases build up inside the dead woman's body and expel the unborn child through the birth canal. Unfortunately, the child never survives, but there are cases where the child is born alive, and that is not a coffin birth, because the woman hasn't been buried. In the case of a child being born alive after the mother's death, it is called a post-mortem delivery, and it's generally achieved by C-section. And here we've got an arrow pointing between the mother's legs to where the infant's bones are.
Okay, I've heard of such things happening in modern days with postmortem births, but I didn't know that they went back to coffin births way back then.
Oh yeah, I mean, we don't have coffin births really happening these days, usually, because of modern embalming techniques, but I actually read about a study in which somebody found a heroin addict who had hung herself, and she hadn't been found for a few days, and they actually found her with her unborn child. She was 8 months pregnant, and the gases had expelled her unborn child downward through the birth canal, and so you had post-mortem fetal extrusion right there. Yeah. So it does still happen once in a great while today, but usually not, thanks to modern embalming techniques. So from merely macabre, we move on to macabre and cannibalistic. This is a picture of blood medicine. And yes, it has actual human blood in it.
Ew.
It was taken freshly from the corpse as possible in order to maintain as much vitality as possible.
Oh, that's an old term.
Oh, back in the Renaissance when this started, everybody did this. Seriously.
Oh boy.
Kings and other nobles, but also merchants, anybody really who could afford a doctor, priests.
Oh boy.
Yeah, I know. And it kind of grossed me out. And it was weird because here, on the one hand, you have a taboo against cannibalism, which was more enforced by Native Americans in the New World than it was in Europe. So, on the one hand, you have this taboo against cannibalism, and on the other hand, you have this idea that blood and bone and even meat from the corpse can cure you. So again, we have information from Smithsonian Magazine. I love it. This is not a paid endorsement. I just really, really love Smithsonian Magazine.
They're a good source of information.
They are. They're great. I love it. And it tells us that the practice peaked in the 16th and 17th centuries, but didn't come to an end until the Victorian period. And it's not just blood either. Egyptian mummies were stolen for this practice.
Yeah, I've heard about that.
Which isn't surprising because they were also using the wrappings to make paint. They would crush it into a paint, and the paint was called mummy brown.
They also burned mummies to power steam engines.
Yes. They didn't realize what they were doing, or maybe they did, and they were just that twisted? I don't know.
Mummies were supposedly that plentiful originally.
Supposedly. We know they weren't really that plentiful. Especially mummified kings and queens.
Not kings, but like the general person. Mummified bodies were found in the desert.
Yeah, but what I read, again, in the Smithsonian Magazine, and in other sources too, was that sometimes it was a king.
Yeah, sometimes though it was also a general worker who was called a king
That too.
to make the mummy go for more.
Yeah, because you would do that to make the mummy go for more money. And of course, you had the grave robbers.
Yeah.
And you know what? Okay, you know how there's always been this thing, Irish versus English? And how Ireland didn't have its independence until after World War One?
Yeah.
Okay, well, guess what? It was Irish graves that were robbed. And the skulls, especially, were stolen from them to make into skull medicine and corpse medicine to sell to the English. And all because of this mistaken idea that corpse medicine could cure everything from headaches to epilepsy.
People are just dying for a cure.
Yeah. Okay, I swear we are done with the macabre now. We are done with the cannibalism and dealing with death.
Not quite.
Kind of. Okay, we're done talking about corpse medicine and corpses.
This one has to deal with immortality.
Yes, but we're done dealing with death.
Well,
and
different causes.
Okay, so we tend to think of mercury as something in thermometers. After all, it expands with heat, shrinks with cold. It's a gorgeous metal.
Also known as quicksilver.
It's the only metal that is liquid at room temperature.
Yeah.
If I remember my high school chemistry correctly.
Yeah.
And my college chemistry, which I was really, really bad at. But it's also toxic. And thanks to its extremely minute inclusion in vaccines and a poorly written and discredited paper that was written by a doctor who was stripped of his license for said paper, it has been falsely linked with autism.
And repeating that falsely linked has been discredited and disproven many times.
Okay, so you hear that? You understand that? Get your kids vaxxed. Make sure you keep your own vaccines up to date. Seriously, we are pro-science here at Unschooled History, and we are pro-vaccine. I don't want to see a argument break out in the comments, but that is the official viewpoint here at Unschooled History.
Aye.
Do not repeat stupid shit. We will shut you down. And if you still want to repeat stupid stuff on this channel, we'll block you. We will, because we do not want false news. We do not want false medical advice, bad advice. We don't want stupid shit being spread about.
No.
And so get your kids vaxxed. Don't believe the stupid stuff. Don't believe Jenny McCarthy. Don't believe anyone who tells you that vaccines are bad, because they're not. They're great. So historically, mercury has been used medicinally, otherwise, outside of vaccines.
Yes.
And in much larger, much more toxic doses. It was used as a diuretic.
Mm-hmm.
It was used as a topical disinfectant, a laxative, and even as a treatment for syphilis. And this was especially important. Guys, just imagine this. The mercury when it was used as a treatment for syphilis, guess where the syringe went?
That's right, fellas. The mercury was injected into your little guy.
Right into the head.
Your little fella got to have mercury, and that heavy metal did a little damage. If you've heard the song from Heavy Metal Poisoning, you got it.
And I remember the first time I heard that. It was on a show on the History Channel about Old West medicine and stuff. I don't remember the name of the show, but it was really awesome.
Old West Tech.
Yeah, Old West Tech or Wild West Tech.
Yeah, Wild West Tech.
Something like that. Yeah. But it was a really, really cool show. And it wasn't just in Western medicine either. In China and Tibet, mercury was thought to sustain life and even grant immortality. In fact, the first emperor of China, whose tomb contained hundreds of terracotta warriors and rivers of mercury, was killed because his attempt at extending his life and achieving immortality involved drinking a mixture of mercury and jade.
Well, let me clarify. He wasn't killed. He died because of mercury poisoning from drinking the mercury and jade mixture.
So yes, he was killed by the mercury.
But he wasn't. He did.
He wasn't murdering.
He
It wasn't murdered. It wasn't suicide. But that's how he died.
And mercury will drive a person insane.
Yes.
If they keep taking doses of it.
It absolutely will. It's bad. Don't do it. That's why we no longer have mercury thermometers. Now, if you have what looks like a mercury thermometer and it's a newer one, it's not mercury. It's colored alcohol.
If you've heard the expression "mad as a hatter," it comes from back when people were making hats at the turn of the 19th to 20th century. They used to stiffen the hat with mercury, and the mercury fuse would eventually, after prolonged exposure, drive them insane.
Hence the character in Alice in Wonderland.
Mm-hmm.
So, again, don't mess with it. I know it's pretty. It's gorgeous. I do like to look at it. But in pictures, guys. In pictures.
If you do have any old mercury thermometers or anything around, I would recommend putting them where your kids can't get at them. Because I know from working with them at schools and stuff, they are dangerous. And kids love to watch that mercury go back and forth.
And be careful. Some things today do still have mercury in them. Like car batteries.
And TVs made before 2015 have a little bit in their solder.
And because of that, and because of inappropriately getting rid of some of these things, that's why we have mercury in our water and mercury in some fish, like sharks.
Sharks, swordfish.
And that's why if you're pregnant, you have to be very, very careful about what fish you eat. Just don't bother with anything that's known to be heavy mercury. Tuna.
Certain tuna.
And don't eat sushi. Because sushi is usually made with a type of tuna.
Not all sushi, but
Not all sushi, but a lot of sushi.
yeah, you have to know what type of sushi you're getting.
Yeah. In fact, they recommend that pregnant women don't eat sushi at all.
Yeah.
Simply because there could be mercury in the fish. So be careful with this stuff if you have to deal with it. I don't want to. It's toxic. It's bad. And I'm glad we don't use it regularly for medicine anymore.
No.
Okay, get ready to squash that inner freshman. Or maybe just let it out for a good giggle. I don't know. Which one are you going to do? Probably giggle, right?
A little giggling. Then again, I'm also looking at this next subject from a very ancient point of view that is not got a lot of documentation to it, but it's got a lot of legend to it.
Yeah. Let's tell the legend.
The legend is that Cleopatra is supposedly the inventor of the first vibrator.
Yes.
She did it by either her or one of her people putting special beetles inside of a stick and these beetles would vibrate their wings to cool off when they got warm, and the vibrating their wings vibrated the stick.
The dildo.
That's what it became known as, but at the time it was just the stick.
That's the legend, though.
There's no proof of it either way to disprove it or prove it. It's just not covered. You get in the ancient sex manuals and things that talk about that. Literature is all over about it. You go to historical documentation where it talks about historical science and everything important from a scientific point of view. Nothing either way. Nobody will talk about it. It's a taboo subject. They won't say whether it exists or whether it doesn't.
Officially, they were invented in the 1870s for medicine.
Yeah.
For medicine. Everybody knows, it's common knowledge that it was used on women. But it was used on men too, believe it or not.
Mm-hmm.
It was used to treat arthritis, tumors, constipation, and in women it was used to treat amenorrhea or the absence of periods. But the famous usage was very misogynistic.
Yeah.
Because the idea was that women who were experiencing anxiety or shortness of breath or fainting, insomnia, irritability, they read too much, or sexually forward behavior. In other words, they actually liked sex. The idea was that they were suffering from hysteria, which of course comes from the Greek word for the uterus. And it wasn't just the vibrator, because there was the rest cure too. Yeah. For all of these things, especially if a woman read or wrote too much.
Yeah.
God forbid a woman have her own thoughts, and God forbid a woman read anything other than the Bible. And so, the rest cure.
Going for that, at the time it was also discouraged that anybody read anything but the Bible.
Well, that's true. But it was far more acceptable in men than in women. And so they were prescribed the rest cure, in which they were kept in bed.
Yeah.
And sometimes the use of a vibrator would go along with it.
Yeah.
And the rest cure would just make things worse.
Yeah.
And women started to really enjoy the vibrator. And that is why it got banned for a while by, what was it, McCarthy? No.
I honestly don't remember which political leader banned it.
It wasn't McCarthy, because that was the 1950s.
I can't remember which one banned it. But it was
I'm Googling it.
We're not ashamed to admit we will Google stuff at spur of the moment, even during these broadcasts, if we forget something.
Who banned vibrators? No, that's not bringing it up. Who banned obscene materials?
I know.
Comstock!
Oh, yeah, the Comstock trials.
It was the Comstock Law in 1873. And so Comstock ended up banning the sale of vibrators and ads in magazines like McClure. McClure, Sears sold them.
Yeah.
They were so mainstream before Comstock came along. And now they're still kind of taboo.
Yeah.
But there you go. It was medicine originally.
Yes.
And let's face it, some women would hope for a hysteria diagnosis so they could get the vibrator.
Yeah.
And it became something that women would buy to have in their homes at all times so they didn't have to see the doctor. So there you go.
Now, before anybody jumps my case on this, I want to make a comment. I think some of the vibrators were quackery, because if you look at the designs themselves were dangerous. Some of the designs were perfectly safe for women and everything, and served a good purpose for women. But some of them were pure quackery.
Modern vibrators, of course, are perfectly safe.
Yes, I'm just talking about the ones back in the 1870s and such. If you look, some of those were not designed safe, and they sparked, and they overheated, and did other things, and they could seriously have hurt the woman.
Yeah. We do not pass moral judgment here on Unschooled History.
No.
That's not our job. Yes, we're Catholic.
Yeah.
We admit that, but we're not passing moral. That's not our job to pass moral judgment here. Our job is to be factual and to give you guys history.
When I give a sort of judgment, my judgment is on safety and whether or not the item was in fact, well, basically safe.
I'm looking at the designs of some of these attachments, and they don't look fun to me. One of them looks kind of spiky, and I don't think I would want that used anywhere near me.
There's one of them that looks almost like a hand drill.
Yeah, that one scares me too. Yeah, no, just guys, just stick to modern ones. If you
collect odd, or not odd, but old things, collect them. Everything. I just would recommend using them. I just say collect them, put them on a shelf, put them in a display case. Nothing wrong with that. We're just talking about for safety's sake.
like on that show, Oddities.
Yeah.
That's a good show. I like that one. I've actually seen some of these old ones on that show, and I think, if I remember correctly.
Yeah.
It's been a few years since I've seen the show. But, yeah, they look dangerous in their older form. I'm sure some of them were perfectly safe, but some of them just look a little dangerous, and just, if you're going to use one, stick with a more modern design.
Yeah.
Seriously. And you thought that Weird Science was all about the past, didn't you? Y'all, check this out. This is osteoodonto I can pronounce it. Yeah, keratoprosthesis. Osteoodonto keratoprosthesis. It's a long word. long fancy word that basically means a dental implant in the eye. They remove a tooth from your mouth. It's usually a molar, a premolar, one of those. And they drill a hole through it and insert a lens. And they also remove a patch of skin from your mouth, from your cheek.
cheek, yes.
And
we need to mention this is done on a person who can't see already.
Yeah, this is done on somebody who is blind. Okay, and it's an expensive surgery to have done. It's not covered by most insurances as far as I know. It's not something you have done unless you really, really need it. You're likely to have it go bad. It's likely to stop working after 5 or 10 years. There's something like a 20% rate of it still being viable and still working after 10 years. So it's not something you just do for kicks. Especially with everything that's involved, because it takes months for it to be done. They take the patch of skin, and after removing your eyeball and everything inside the eye and part of your inner eyelid, if y'all could see Michael's face, he's looking like he is getting a little sick, he's getting a little pale.
I don't do too good with this sort of surgery.
I do. Well, talking about it, I do. I can never actually watch it, I don't think. But then they take the patch of skin from your mouth, from your cheek, and they attach it over your eye long enough to get a blood flow going. And then they attach the tooth inside your mouth into your cheek to get a new blood flow going there. And then, after that's all done, then they cut a hole into the skin that's been grafted over your eye, and then they insert the tooth with the ocular lens to let the light in. And that is how this works. So, as you can see, you have the tooth in there, you have the lens in there, it lets you see, but it's not the prettiest thing, it's not something you do on a whim, it's something you do when you're desperate for sight and you're blind. And most people do not do it unless it's highly recommended and they can get insurance to pay for it, which again, as far as we know, most insurances won't pay for it. If you work insurance and you happen to know that your insurance that you work for does cover it, or if you've ever actually had this done, please, please, please leave a comment. I want to know more. I do. It wasn't easy to find information on this, and I want to know more about this, especially if you are a surgeon who's done it or if you've had it done. Seriously.
Or if you work with an insurance company who's had to deal with covering this.
Yes, that too. This was pioneered in the 1960s. It's still done today. And of course, weird medicine is still being developed. Ladies and gentlemen, I introduce you to One Baby, Three Parents. It is a process in which they do a mitochondrial transfer, and it is called mitochondrial DNA therapy. And it actually creates a child with 3 genetic parents. It starts with a process similar to IVF because they have to remove an egg. So you have to have either the mother's egg or the donor's egg, either one, pulled out, whichever one has the bad mitochondrial DNA. They fertilize the egg with the father's sperm before removing the bad mitochondrial DNA. And then they insert the healthy mitochondrial DNA from the donor and remove the donor's other DNA before implanting the embryo back into the mother. It's a therapy. It's a type of gene therapy. And it's ethically questionable. It is.
Yeah.
We understand why some women might turn to it. But on the other hand, are we on the path to designer babies and turning children who should only be loved into nothing but a commodity?
Genetic engineering.
Infertility is heartbreaking.
Yes, it is.
I'm infertile.
We both are basically anymore.
We tried for years to have a baby until I was finally told I can't carry a child to term safely. I can't.
I was blessed with a child earlier in my life, but now due to massive doses of radiation, I'm no longer.
So,
Between
honestly,
medications and radiation.
We know the heartbreak of infertility. I still cry sometimes.
Yeah.
And I still wonder what it would be like to raise a child. So we understand the heartbreak of infertility. But as a people, as the human race, we have to find where do we draw the line to help infertile couples reproduce. And we have to understand we cannot turn human beings into a commodity to be bought and sold. And that's the worrisome thing, because that's something that here in the US, at least, we fought a war over.
Yeah.
Over whether it was right or not to buy and sell human beings. And in the end, it was determined, no, it's not right to buy and sell human beings.
No.
So, how can we turn our children into a commodity to be bought and sold based on genetics? So there's a lot of questions out there. But again, we do understand why somebody might go this route. One of the articles I read while we were researching this was an interview with a woman who actually gave birth to one of these babies. She lives in Eastern Europe, and she was desperate to have a child. She and her husband had been married for 10 years, and she could not produce a healthy egg because of a mitochondrial DNA defect. And so they went through this process as part of the experimentations and the development of this process. And they were one of the first successes. And I'm happy for her that she has the baby. I'm very, very happy that she was able to fulfill her dream of motherhood. But
at the same time, at what cost?
Yes, what's the cost? Is it actually ethical? Where do we draw the line? That's the question. So we are still going into the future with what would be considered weird medicine. Where is medicine going in the future? That's the question. We don't know. Will our descendants call what we view as perfectly normal weird medicine? Nobody knows.
No.
But one thing's for sure, history will always be interesting.
Yes.
Is there something in history you want to know more about? Let us know in the comments below. And as always, make sure you've hit that subscribe button so that you never miss an episode. And don't forget to check the video subscription for a link to our Facebook page, where we post not only our videos, but a daily history fact.
Have a good evening.